With joint replacement surgeries becoming increasingly common in workers' compensation, this study provides a consistent framework for tracking these surgeries and gives a better understanding of who receives them, where they occur, and how surgical choices influence claim costs and outcomes. The report focuses on shoulder, hip, and knee replacements, which represent the majority of joint replacement surgeries in workers' compensation. The study, titled Recent Trends in Joint Replacement Among Workers' Compensation Claims, answers several important questions. How often are these surgeries performed and in what settings? Inpatient, hospital, outpatient, or ambulatory surgical centers? Who are the workers receiving them? How much do claims with these surgeries cost? And how long is the worker's disability duration? How often do workers with joint replacement procedures have revision surgery? Beyond the numbers, the study authors discuss several implications, including the growing importance of health promotion and musculoskeletal wellness programs. They also explore how state policies may influence surgical trends, clinical approaches, and overall claim costs. As joint replacement surgeries continue to rise, understanding these patterns is essential for employers, insurers, medical providers, and policymakers. We hope you found this video helpful and download their study. If you did like the video, click on the thumbs up button below. Also, please subscribe to our channel to stay informed of WCRI's latest research and discussions about important workers' compensation topics. Thanks for watching.